What is the strangest behavior you have seen in childhood? When I was on my pet psych rotation in medical school, I had a little girl at our facility because her mother was so afraid of her that she allegedly took her new puppy to the bathroom and killed it by dumping it in the toilet. When questioned about it, she admitted that her younger brother was to blame. Her mother brought her to our unit because she thought she was going to hurt one of her siblings. She didn't respond at all like a youngster might to the loss of their puppy when we talked to her. She was composed and unflappable, although she did injure her puppy, and she held her brother accountable. Her traditional mannerisms lead us to suspect she may have had autism, but it was a strange case edit. I'll explain a handful of the many responses I've received. The attending physician thought it was autism rather than some sort of psychosis or personality issue because the girl was too young for a solid diagnosis. And we think the mother gave us a biased narrative because she was terrified. She acted in ways that are typical of some types of autism, such as cramming food into her mouth while eating. And she thought she was playing with the dog, not understanding that she was hurting it or that the laughter was just a common response to misinterpreting the situation. I'm not aware of any trauma, but she had trouble reading social cues. I'm not sure where they sent her, and the facility wasn't really built for long-term stays, so she was just an inpatient for a short while. I disagreed with the diagnosis of autism, but as a medical student, I chose to lean toward sociopathic behavior rather than argue with the chief physician. Before she abandoned me on a gravel road, my mother had no mental health treatment, and she loved hanging kittens and drowning them. As she grew older, she became increasingly hostile, and now that she is, I guess, out of your life, I hope things are going better for you. She killed her own mother when I was 4 years old. You have to watch The Cruel Ones. On February 11th, 2018, I was a medical student here when Mom died. The boy entered the room in a wheelchair, his hands and neck free, during a general examination with a pediatric specialist. He was a true Hannibal Lecter __, with facial, lip, and limb scars. I tried to get close to him, and he tried to bite me. Leishmaniasis, an enzyme deficiency that causes the body to accumulate uric acid, was the condition he had. It results in many behavioral disorders and severe wounds from lip biting and other activities. Holy __, I hope that the poor child is now all right. Approximately 60% of people who have it have all of their teeth pulled, according to my research. This is incredibly rare. Therefore, I'm surprised to find it on this site. They don't live long. Therefore, the child you saw is most likely dead or very close to it. My spouse's brother had that. However, despite all of their pain, children are good at smiling. When he swallowed, my 14-year-old was constantly grinning in every photo, even though he had many kidney stones as a newborn and could only speak a few words. He appeared content overall and needed to take medication. Although his death was agonizing and debilitating, I'm relieved that he is no longer suffering. Following a thorough follow-up with a psychiatrist and confirmation that the BBS were not made of lead, she denied having any history or ideation of self-harm, stating that she just felt that it was the call of the day. She also required multiple follow-up x-rays to monitor how the BBS were clearing her system, and a whole canister of them. In nursing school, I was matched with a 10-year-old kid who was displaying indications of cancer. Several youngsters were inhaling red-hot Cheetos, which caused headaches. According to the emergency room physician, who is not a pediatric specialist, I asked them why, and they told me that it gave them headaches. I went to the playroom to keep him company because I had some free time. I attempted to swiftly switch activities when he started looking through the computer for adult content, but he was very adamant. When I brought it up to his nurse, she basically informed me that he does that every day to avoid being harassed. Why would you let a youngster even search for that in the first place? How many people did not succeed at their work here, and it should have been taken away? No, I said. He could use the computer in the playroom, but I stopped him by rerouting him when he pulled it up. Once he was off the computer, I told his nurse what else I could have done. I hold a degree in psychology and work as a personal support worker. I worked with a group home that housed aggressive boys. The 11-year-old boy was perhaps the first child I had ever worked with of whom I was genuinely terrified. Whenever he went, he would torment his family's pets, attempt to buy off and force the other inhabitants to have sex, and always construct weapons out of whatever materials were available, including throwing his own urine at staff, only when he wanted something, and you could see how good he was at acting. Would he calmly and gently tell you how he was going to murder you, even though he was the sweetest, most sensitive child ever. In addition to threatening to abort me while I was pregnant, he openly admitted that he wanted to kill every female employee, including me. I've worked with many violent children who suffer from mental health disorders, but he's the first I've seen with that void behind his eyes. He stabbed his instructor in the throat with a pencil the year after I started a new job, forcing him to be moved to a locked children's mental health facility. Regretfully, it should never have occurred because incarcerating someone before they commit a crime is impossible. However, as the house and staff had advised, you can move him to another home where he won't have many opportunities to use his surroundings as weapons. Although the youngster most likely had an antisocial personality disorder, I probably wouldn't diagnose it now because it was identified as a cluster condition at his age, but we knew it was coming when the school said they were all right. Keep in mind that this child had also suffered greatly. One of my patients, a final-year pediatrician, had severe pneumonia after consuming non-food objects like paper, pencils, door hinges, and nails. In order to prevent items from getting into their mouth, the patient basically required a full-time nurse. I'm sorry for my bad grammar. I'm leaving Japan. Based on blood test results, the daughter was told that Nega loves My Little Pony, but will eat pieces of wood if you don't watch her. In addition, she has attempted to consume metal tables, and if she can get her tongue on them, will eat pieces of the plastic pony figurines we bought her. We must keep an eye on her at all times since she will try to devour it. She has PA if she eats something that isn't really nutritious, although it could be a behavioral issue. Your doctor probably meant that she doesn't have a nutrition problem. Children with autism, anxiety, and unknown hereditary diseases exhibit this, in my opinion. While in medical school, a 9-year-old girl successfully courted a guy I knew. A social worker accompanied 4 of the children who arrived, and the attendant saw each child separately with the social professional. During this procedure, he was asked to keep an eye on the other kids. The girl was coloring and drawing while saying some really offensive things. He obviously called for a nurse and went to tell his senior what had transpired. It appears that because of an extremely challenging upbringing, she would frequently do this with adult males. God, no, it is. Thankfully, he was able to report it rather than saying, "Well, I don't want to be accused of anything strange." He took this action for 2 reasons. First, a child on his pediatric rotation was acting out, and second, he knew about a child who went into the nurse's office saying he was feeling sick. And my dad, a pediatrician who provides consultations for a school system, was at one of the middle schools completing paperwork. In that situation, he was an adult man, and it is reasonable to assume that he didn't want to be accused of being odd. "I think I drank toilet water," the boy said in response to his father's question about why. Oh, the stories. The school nurse had a student who had just eaten a few staple foods and claimed to be bored. He then concealed a ball of feces in my cupboard near my diabetes prescriptions. 2 small children got into a fight in my workplace, and they also snarled and scratched at one another. The diabetic's pants rolled out onto the classroom floor when another youngster threw up on them. While they were there for their lunch correction, another kid inserted a pencil into it as well. Because she had a teenage kid who would continuously put things in her butt, my wife, a pediatrician, became increasingly creative as items were taken out of her room and destroyed the room's soap dispenser. She needed to have screws, shattered CD fragments, and other objects removed, so she had to go to the operating room. Only a Presidex drip, a milder form of propofol, could give them real control over her. An EMT, not a pediatrician, once had a 4-year-old who broke off medical equipment from her hospital bed. By getting into the plastic pieces, he decided he didn't want the stitches in any longer, a few days before the circumcision procedure, and he picked at them until they ruptured. His mother found him watching a dinosaur movie in his jammies, his crotch dripping blood. According to the children, it hurt only a little. Edit, Please don't PM me about the mutilation. I wasn't. Many of these stories sound similar to my former work as a counselor at a children's mental hospital. A 9-year-old boy who was brought in because he was not only acting inappropriately sexually, was one of our patients. All I did was apply a bandage to the child's willy. He enjoyed rearranging items in his neighbors' homes when he was initially introduced to the area, then hiding in the closet to observe how people reacted, along with often breaking into neighboring homes for no other reason than to do so. He would also torment their animals. A co-worker and I were asking him and the other patients one day what they hoped to become when they grew up, using lighter fluid on matches he had brought with him in case he was caught. The homeowner caught him. He had tried to burn down the house, gave typical answers like police officer or baseball player, but when this child's turn came, he spontaneously stated, "I want to be a grapist," without any shame or irony. There's that scene from Halloween where Dr. Loomis says, "There's nothing behind Michael Myers' eyes, aside from immorality." I understood what he meant when he mentioned that he frequently broke into neighbors' houses in the afternoons for fun and enjoyed rearranging their belongings. To prepare for their creepy crawling, Charles Manson and his family did this __. It's strange because I used to think that Charles Manson would do them as practice runs when he was in the hospital, and I said the same thing about him and the creepy crawling. He related to us several instances in which he escaped detection. Subsequent antics are not really encouraging for that child's future. If a youngster is caught in someone else's home, he is either placed in a home or ward for the rest of his life, or is constantly watched over by his parents. I can't think that this is something that can be resolved because I'm not a doctor. But what happens to the individual I stated roughly 3 years later? He passed suddenly in the middle of the night at a long-term care home in the next municipality. After departing our facility, according to the announcement, because of his history of severe grand mal seizures and medication cheating. I suspected that when I found out what had happened. He was pretending to take his overnight medication, but he didn't, and he died in the middle of the night from a seizure. I remember feeling torn when I heard the news because I knew that he had loved and cared for others. But I also knew that I would never be pleased to see someone die, especially so young. All of your suggestions, parent supervision, placing the kids in a state ward, etc., have the potential to save some lives. So I wish I knew what to do with the kids in this circumstance. Activities that are performed frequently but yield erratic outcomes. There were some patients you knew were going to harm them, but the ALA minority report says you can't really convict someone for a crime they haven't yet committed. I wasn't startled, but it was awful to hear about the death of a teenager. And another patient I met when he was 11 years old was later found guilty of torture. I heard a parent describe to a pediatrician this peculiar situation involving her child, who was around 5 years old, how he had been discussing death and how afraid he was of dying for the previous 3 weeks, to the extent that he was trying to avoid sleeping out of fear. The provider asked the mother if there had been a recent death in the family, or if something had happened at daycare. Questioning for 10 or 15 minutes revealed that the odd conduct began following the family's most recent movie together, Boss Baby TLDR. A 5-year-old had an existential crisis as a result of Boss Baby. A 10-year-old boy was previously hauled in by Family Doc for exploring the internet for homosexual adult films all the time, especially ones with twinks and older males. I assumed the child would be abused or something, so CPS stepped in, but their investigation turned up nothing. He was raised by a single mother under close supervision and kept apart from adult males, except for school, where he strongly denied ever having been abused. In the end, the toddler was just homosexual and curious, which alarmed so many adults that it resulted in weeks of social worker visits and investigation. Because mom also indicated concern about legal repercussions and wanted to be transparent, I trusted her when she told me she wanted to contact CPS because she thought someone was abusing her child, although I really wanted to just send the child to an LGBT-accepting therapist. I had to report the child's alleged abuse at the mother's place of employment, where she worked as a nurse for approximately 20 years, because I'm legally required to report any suspicions of abuse. Although the child, who is roughly 10 years old, is perfectly normal. His breath is the worst. This didn't stay this long, but when my kid was 3 or 4 years old, he had a similar experience. It came out that years before, he had shoved a tiny eraser up his nose, which is why he would experience horrific nosebleeds due to hemophilia. It wasn't a spaghetti monster, thank God. The first thing they did was roll up a piece of tissue and push it in his nose, leaving a bunch hanging out. This would prevent the blood from flowing down the front of his shirt and into the house, but it wouldn't stop the bleeding. They would stop after a few hours since he needs clotting factor every other day. But it wasn't there. We've called him a plugger since he was a toddler, to the point where he would come in as if OJ had just stopped by and say, "Dad, I need a plugger," one day, as we were snuggling on the couch. I kept smelling like death, so I checked my throat. "Are you putting a nose plug in?" With pride, he smiles. "Indeed, Daddy, I did. I had blood on my nose. It was just me." The couch was ripped apart by shoes looking for hidden bad food. Even though there were a few children around, nothing happened until I got a good whiff of his breath. Using a flashlight and some hemostats, I was able to remove it last week, even though I couldn't see it. It had a heated roadkill odor and was clawy and brown. I have no medical training, to start, but this youngster has mental health problems on both sides of my family. My parents, there are 2 of me, since they were young, 2 male cousins have committed by killing animals for fun, blaming others and denying it, and yes, it did cause them to harm someone else. The poor kid was given the 3rd degree when one of them set his friend's pants on fire. My cousin shrugged when they asked him what the was, saying, "I just wanted to see what happened when human skin burned." He was also moved to live with my family not too long ago, although he didn't give up both legs until lately. I know bits and pieces about the other, who grew up on a farm. He had a bad tendency to randomly drop his pants and swing his junk while he was out and about. He was also known for breaking the necks of animals and would get very excited when the family had to butcher them, applauding and leaping about in the blood. I know he won't get it, but he may have tried to grope a few girls when I last heard from him. When he was still mentally ill, the neck and body would separate as he spun around with the birds and bodies. Any help? Our family is very isolated in Mexico, and we don't let anyone else inside the ranch. Also, his parents have been refusing to acknowledge that he has a problem. He works as a pediatric medical assistant and is not a doctor. One of his children arrived with the usual case of mom not paying attention. When I was 8 years old, my doctor was doing a physical examination for a well-child check, and he got to the section where he had to check the child's genitalia for appropriate growth and development. While the doctor was checking the youngster's dick, the child laughed the whole time and went out of the clinic without any issues. After a few weeks, the waiting area is crowded with parents and children of all ages, both well and sick. I notice the happy child passing by the door as I call the next patient, and my doctor is standing directly behind the door, brewing coffee. He sees my doctor before it closes and shouts, "You touched my wiener the last time I was here. This time I get to touch yours, edit. I'm not a doctor. This is a story about a parent, not a child, and I'm not very good at typing on my phone. But in the state system, the only mental institution that accepts children is the one where I work. A girl named T had been with us since she was about 11 years old. She would do well before being released home to her mother, and when her behavior deteriorated, she would return to the hospital. One of my co-workers saw that T was acting strangely when her mother came to visit her one day. She is violent. When Mom asked T whether she was okay after she left, she started crying. She then handed a small wad of tissues to my co-worker, concealing multiple disposable razor heads inside. When T's daughter was about to turn 18, her mother gave them to her and told her to either ingest them or use them on herself, to sue the state for not providing enough supervision. She also told T that she would have to go through with the plan or never go home. Since we sent her back to her mother, who tried to convince her to hurt herself severely to get quick money, but she changed her mind after finding out T was expecting. All of that comes to me, even though I haven't seen her in 10 or 12 months. Despite being a medical student who graduated often, I spent much of my time working with children. The strangest incident occurred during my family medicine rotation when a child, who I think was 8 or 9 years old, came in for a checkup. Because I'm so weird, my preceptor said, "You need to see this. I think you'll get along, kid." Despite being the strangest 8-year-old ever, this child was absolutely fantastic. He spoke with the intelligence and eloquence of a scholar of 35. Intricate D&D campaign, story setups that he would invent and write, were always included in the big book or album he carried with him, down so he would have it ready when the time came. We connected over our PGs, books, and other subjects. I was 31 at the time. Unbeknownst to me, this young man knew several of the leading sociologists, and I informed him that my husband was working on a PhD in sociology. His mother would just sit behind him and nod her head before saying, "I don't know what he's talking about." He pursued all of his interests on his own initiative, and that level of fervor and interest is kind of uncommon to witness in a child when it's not shared by someone close to them. He was so excited to have someone who truly cared about what he was. His preparations for these epic D&D games, including the activities he had set up, the stories he had written, and more, were a major topic of his talk. One of the reasons he is so memorable to me is because of this. Well, I'm still looking for them. I don't really have any friends yet, but when I do, I'll be ready. He responded quietly in response to my question about how often he and his pals played. The fact that this young kid spent so much time making this environment for pals he couldn't find made me feel both sad and inspired. I expect adolescence to be very difficult for him, but this child will undoubtedly dominate when he is an adult. The other abnormalities were, I guess, really rare hereditary diseases and terrible mental problems, which are even more gloomy to talk about, in contrast to the bright 8-year-olds who will probably run the country in the future. He will make friends. It will be hard for anyone to overlook someone as remarkable as him. In fact, his companionship will make his friends better people. He was one of those children you wish were grown up, so he wouldn't have to deal with all the embarrassing things that he's likely to face, and find attributes that people find great because he is. But I have faith that he will eventually grow up